Endometriosis is something which a lot of women these days are struggling with. And I couldn't have been happier when I realized that I had two people who I know coming together to start off with their own intervention as far as endometriosis is concerned, known as Endo Crusaders. So today I'm very happy to have with me Dr. Vimi Bindra and Dr. Shilpa Rao. Dr. Vimi is a consultant gynecologist and a laparoscopic surgeon with Apollo Hospitals in Hyderabad. And she's an expert at handling endometriosis cases for like many, many years now. Dr. Shilpa Rao is a dental practitioner and founder of Sweet Smiles Dental Clinic in Pune. And she, interestingly, has battled endometriosis herself and hence is passionate about what she, this venture that they have started off with. So welcome, both of you.
Thank you.
Thanks, Sheetal.
Sure. So, first things first, I would just want to understand from both of you as to how did you guys get about coming together to start with this group, as in what was really your thought behind it?
So first and foremost, Vime and I have been like friends since childhood. And I think we've been really close. And endometriosis, when I got detected with endometriosis, I think that got us closer. I fighting it and she fighting for it. So that's what got us together, I think. What say with me?
Yeah, true. So Shilpa was suffering with endometriosis for so many years, and she used to keep asking me her doubts and what treatment she's undergoing. Right. And I have really seen her suffering, be it pain or infertility or multiple surgeries she has undergone. And not only the major symptoms, it also causes mood swings, fatigue, and I have seen her going through all this.
Sure.
Okay. So this endometriosis, 1 in 10 women are suffering now, and globally more than 200 million women are suffering with endometriosis. But still a lot of awareness is lacking. So that is how we decided, both of us, that let's start a group so that like-minded people can come together, and when we are handful, we can spread more awareness, educate more people, and get them the right treatment on time. Because the diagnosis is delayed.
Yeah, and also because worldwide period pain is considered normal. A woman is supposed to be having period pain, and it's up to her to endure the pain, which is supposed to be the nature of a woman.
Understood.
So people, women especially, don't come out of, don't
I think it's just considered to be very normal, right? As in, it's not something which is discussed.
And again,
yes.
It is considered to be talking about menstrual health. There is a big taboo about it.
Very true. Very
yes,
true.
As Shilpa rightly mentioned that this is a big taboo with menstruation. Anything regarding menstruation you should not talk about. Right. And in Indian culture, it is more prevalent.
No, and so in so many ways, in so many ways, I think having seen it so up close and personal with Shilpa going through the situation herself, I think as families, we understand the struggle, but then sometimes it does leave you with a thought that maybe had it been diagnosed sooner, or if we were to have been made aware of, the repercussions that it could have had, maybe things would have been very, very different,
Absolutely true, Sheetal. As you said, because the young girl, when she starts having pain, and if pain is so severe that she can't go to school or can't do routine activities, that is the first indication where we should suspect endometriosis.
True.
But what happens is she goes to a gynecologist. Gynecologists are also not aware, and they tell them that this kind of pain is normal. There is nothing on ultrasound.
Correct.
So that myth and taboo has to be clarified, and people need to understand that there is something wrong if she's not able to do routine activities.
Got that. So maybe that's one of the reasons why it just goes so unnoticed, because it seems very normal on the face of it, or acceptable per se.
You don't look sick.
Yes. Are there other reasons why it may just go unnoticed by families, or by the individual himself, by the individual herself?
Sometimes it happens when a woman is trying for pregnancy. Then she is diagnosed with a grade 4 endometriosis, and it can be completely asymptomatic for her. Like it doesn't cause pain, but the disease is so progressive that it damages her ovaries, tubes, and all the pelvic organs.
Oh.
So it's a frozen pelvis
Mm.
kind of thing, and it may get unnoticed. And she's detected for the first time during when she's trying for pregnancy, and she approaches
Right.
a doctor.
Oh my God. It can go unnoticed for that long as well, is it?
Yes, it does. Yes,
Wow.
it does.
Okay.
A
So,
lot of
yeah.
healthy couples, a lot
Hmm.
of healthy couples who are infertile, get to know
Mm.
that they are the girl is endometriotic only about, when she's planning a pregnancy. And
My
that's like
God.
very, it's like, it
Yeah,
must
it
be like
must
a
be
shock.
coming like a shock to all of them.
you
Yeah.
know.
Correct,
So
correct.
absolutely.
So
Yes.
I understand. I mean, that it's not just physical; it's a lot of mental support that women who are going through endometriosis require. So, what are your recommendations or suggestions as far as the role that families can play in terms of making sure that the ride is as smooth for the person who's bearing the whole situation per se?
So if you ask me, uh, see, endometriosis is, said to be a hormonal disorder, but
Mm-hmm.
but it is not. I mean, it is, hormone is one part of it.
Mm-hmm.
Okay, that's what I feel. It affects the entire body, right from your
Right.
mind to your body. So it is
Mm-hmm.
not just physical. It's all about, it's mental also, because you go through a lot of depression and a lot of pain. So if you're in pain throughout, if you're fatigued throughout, so obviously it's going to play on your mind.
Yeah.
So
True.
as
Yeah.
a family, I think the family needs to be really strong, and they really have to be empathetic towards the person. If the family doesn't believe that the person is in pain, I think
Mm.
the woman, doesn't have anywhere else to go, and she stops believing in herself.
Absolutely.
you
Absolutely.
know
No, I get that.
so
Yeah.
I think the family has to be really empathetic, and plus the doctors have to believe in the person when the person is saying
Yeah.
that the person, when the person is saying that I'm having pain, so please accept that, the person is not lying.
True, true, very true.
So the most important
Hmm.
part is we need to listen to them.
Yeah, true.
Correct.
What
And
she's
you, I'm
saying.
sure, Vimi, would be going through a lot of cases like these, right? Day in and day out, looking at people, women coming in, they having their own struggles, and with families possibly not being as empathetic, it probably the whole journey becomes all the more difficult for them, right?
Absolutely true. See, these women, basically what we call is endometriosis as an iceberg phenomena. What we
Mm-hmm.
see is
It's
much,
just
much more
Tip,
deeper than that.
tip.
So
Correct.
these women have, apart from pain and infertility,
mm-hmm.
they have, as Shilpa mentioned, they have fatigue, they have mental stress. Sometimes women describe their pain as knives hitting them, needles pricking them all the
Yes,
time.
yes, that's
They
right.
can't have intercourse properly. They
Mm-hmm.
can't have a married life, good married life. So marital disharmony,
Mm-hmm.
and our society is like that. Divorces come up, and so
Yes,
many social issues are associated with this indirectly. So
oh my
this
God.
needs to be addressed, and we need to discuss more and talk about it so that women come out with their own set of problems so that we
Correct.
can help them.
Yeah. Yeah. Great. No, I think in that sense, a community like what you're creating becomes all the more important because it's more like a support group as well, not just in terms of information, but also in terms of providing emotional and mental support to people who are actually going through the situation themselves or the families which are facing it. So tell us a little more about the talk show that you guys are doing on the 12th.
So in this talk show, we are a panel of experts who are there.
Mm-hmm.
So we'll talk about Vimi is the gynac. She is the expert in laparoscopic surgeries and endometriosis excision surgeries. So
Mm-hmm.
she is going to be there, and there's Heather, right? That's what. So she is there. She's been managing the endometriosis care center. She
She's a surgical program director in Atlanta.
Okay.
So yeah, and she's been, and Sally is there, who's been an endometriosis crusader again for a very, very long time, and
Okay.
she is a big part of endometriosis summit.
All right.
And
Yeah.
there's a
And she
nutrition
has designed a pelvic physiotherapy
pelvic
program
pain.
for
Yeah,
Oh, is it? Uh-huh.
pelvic pain for
Okay.
endometriosis patients.
All right.
yeah.
Okay.
And then there's a nutritionist who is going to be
Yes.
talking about what is going to help you, the anti-inflammatory food and all that stuff, which is going to help you with the endometriosis, and an IVF expert
All right.
is going to
Okay.
be
Yes.
there.
So
So I
basically,
think it
you've put
covers
together a panel
everything.
which covers the entire spectrum
It
of
covers, yes, yeah,
endometriosis,
yes,
basically.
it
That's
covers everything.
fantastic. So who is this, talk show for? Who should be really attending the talk show?
I would recommend that talk show should be attended by women who are suffering with painful periods, their family members, and those who have a diagnosis of endometriosis. And also, it should be attended by general gynecologists and physicians who come across these patients and they do refer to us.
Okay, great. Sounds good. So if somebody is interested in registering for the program, for the talk show, how should they go about doing it?
So we have posted a link on our page, and we will share the link with you, Sheetal. So
sure, I'll put that in the show notes as well. Yeah, I think that would be like a good thing to do.
And I think we have a limited registration for 500. If the registrations are full, need not get disappointed because it will be telecasted live also on the FB.
Oh, fantastic. That sounds perfect. Great. I think that's pretty much it. But yeah, thank you so much for being here. And I'm sure you guys will do awesome. I mean, all the best to both of you for what you started off. Yeah.
Thank you so much, Sheetal.